exploring the IPT treatment outline, there's 3 phases of treatment: beginning, middle, and end. Within the initial stage, the focus is on establishing a therapeutic alliance, normalising and validating and providing psychoeducation, normalising and validating the patient's experiences, presenting a case formulation, reviewing symptoms, and problem identification. So IPT involves 10 steps in diagnosing depression, and this forms part of the underpinnings of the case formulation. So looking at number 1 being diagnosis. This is where we assess and explore symptoms severity. We define the diagnosis and using evidence-based rating scales as well to assess that symptom cluster and diagnose what the presenting concerns are. So in step number 2, we're looking at naming and explaining the diagnosis to the patient. This is where we can attach a language to what's going on for them. We identify the condition. We're being able to treat depression as an illness and removing any of those myths or biased lines of thinking in having a disproportionate amount of blame or at fault for experiencing the condition. The third step is validating that the restrictions imposed by the illness are not the patient's fault and acknowledging that the patient's responsibility is engaging and committing to the treatment and being able to improve that. So typically IPT runs between 8 and 16 sessions and it's often delivered in a weekly format. The Interpersonal Inventory is the way to do this and it's how we would implement it when coming from an IPT model. It explores the interactions of the people that are closest to the patient, who is in their inner social circle. We want to look at identifying satisfying, unsatisfying aspects of the relationships. With IPT, in the initial stage of treatment, we're looking at identifying what's known as the focal problem area. The focal problem areas within the IPT model are grief, role disputes, and role transitions or interpersonal deficits. What we're doing is we're relating that problem area to the origins of the depression and identifying areas of what's maintaining it to be able to help identify those areas for improvement and change and goal setting. We're sharing the case formulation with the patient, and this helps validate their experience, build insight, and also build a level of clarity of where the treatment's going. We're looking at helping them understand what the focal problem area is, recognize how impactful it is on their mental state or the development of their condition, and being able to link that to its relationship to the current depression using IPT concepts. Collaboratively deciding on the treatment goals and the focus of treatment so that there's input from the patient that's welcomed. It's that therapeutic alliance that's built within that process, and also insight with linking the importance of interpersonal relationships on their current mental state. Detail in the IPT procedures in terms of length of treatment, frequency, duration, confidentiality, fees and things like that are all covered within that initial stage of treatment. So really looking at the housekeeping kind of stuff about what treatment will look like, what's required, time frame, and designing that so everyone's clearly on the same page with being able to know what's expected and preparing for that along the way. Moving to the next stage of treatment, which is the intermediate stage of IPT. And this is where we're working through the specific problem area that's relevant to the patient, and we're implementing the IPT therapeutic techniques. This stage of treatment, the intermediate stage, focuses on working through the problem areas of either grief, role disputes, or role transitions. It involves the application of IPT techniques addressed in the specific treatment stages. The third stage of IPT treatment is termination. And that's where we're looking at reviewing the symptoms, reviewing the progress of the treatment to ensure that it's contributed to meaningful change or symptom relief or mood improvement. We want to be able to assess the skills acquired throughout the treatment as well. So that gives us a real process of reflection, review, and re-evaluation to make sure that the patient feels comfortable in putting in place the techniques, the skills building that they've worked on throughout the treatment, and making sure that we've got those measurable outcomes of change. An action plan is often part of the process with IPT, where it ensures that consolidation and maintenance of skills so that those treatment benefits don't drop off post-treatment termination.